Morning. Morning.
Good morning.
Sir, any coughing, shortness of breath? No? Been outside the country? Okay. There you go, sir. Call for the day. Oh, thank you.
We're in the new HIDU, or Highly Infectious Disease Unit, located at the Houston Methodist Continuing Care Campus out here in Katy. We opened this unit about a week ago, today's day 9, to help take care of our COVID-19 positive patients in the system. First thing I do is change into my scrubs and then check in on the teams, see how things went last night. And once day shift has gotten here, we like to do just a huddle since we're still a fairly new unit, operationally making sure that we have everything that we need. So good morning. How's night shift? How's the night? Good. All right. So just a couple of updates. I want to just go over kind of where we're at with numbers in the system. So as of now, there's a total of 173 COVID positive patients. This is an old labor and delivery unit. When I got the call about 2 weeks ago about opening the unit, the plan was to open 20 beds within the vision of expanding that to another 23 beds, so a total of 43 beds. So what we did from a recruitment perspective was send a message out to the system asking for folks to volunteer to care for COVID positive 19 patients out here in this campus. We kind of wanted folks that were not too early in their nursing career but had some experience, could demonstrate that bit of a flexibility being that we were going live in such a short amount of time, and then having a good skill mix so that we had a mix of like folks that had experience with high acuity patients and folks that had less experience with that, but being able to mix them in. Everyone's a Houston Methodist employee. They've been working somewhere across our system. The fact that we have all just come together in this short amount of time makes it a little bit more challenging because we don't have folks that have been here for forever and know how the unit works. But at the same time, that has been like the bonding element that has brought everyone together fairly quickly because we're all living this experience at the same time. There's a bit of anxiety or nerves, or it's a little scary kind of getting into a situation where we don't know anyone, we're taking care of this unique population, but everyone was engaged because we were wanting to share the information and keep them up to date with what were the plans for the unit, any new items with PPE or changes in infection control recommendations. All right, guys, well, do handoff and have a great day. Night shift, sleep well. Thanks, guys. Today, we're actually moving all of our patients upstairs to what we're calling HIDU 2 or HIDU 2 on the second floor. So these are the additional 23 beds that we're getting on the unit. The reason why we're moving all of our patients is so that we can finish doing some infrastructure repairs, if you will, to this department right here. Mainly it's the hardwired call bell system, which we don't have.
We walked yesterday the both transfer pathway as well as the admission pathway. Do you need to see that or want to see that?
I just need to know what it is.
Okay.
My challenge has been from a staffing perspective as we get ready to open the second unit, ensuring that we have the right key folks with the right experience to be able to serve as a team lead, as a charge nurse, having folks that have that higher acuity nursing experience, an ICU nurse or ER nurse that could help in a critical incident with the teams, just so that everything's structured well. I feel a little tired. I was reading Dr. Boom's email yesterday where he mentioned he felt tired, so I guess it's okay to say it's okay to feel tired. There's this energy as well that kind of gets you moving, and you see the staff and everyone's engagement, and that's very energizing. For every single person that you'll see here standing, there's probably 10 people behind the scenes that have made this unit possible. So that helps take a little bit of the stress out, but it's still very emotionally straining, and I think probably the bigger thing that adds to the stress is today we have a lot of staff. We're going to open units, staff is going to get thinner, but as the crisis evolves, we may have to even stretch even thinner to take care of our patients. Or something, so like when the patient's being removed, like everyone just kind of stands in silence as the patient is rolled out, just as a way to like.
There would be any way to. I took over care for Richard on Sunday for the first time, so this is my third day with him, and we had a really good day Sunday, so I was like super optimistic that we were making a turn in the right direction. And he's super hard of hearing, and so all gowned up with our masks on and our hoods, it's really hard to communicate with him. And I was like, hey Richard, I hear you have a girlfriend. And he was smiling, and I said, I hear her name is Georgia. And he was just snapped his head at me. He's like, why, yes it is. And he's so super cute. And then I come back on Tuesday and he spiked temperatures and he had to be back on a BiPAP instead of the non-rebreather. And it was really disheartening. So during rounds, the team talked, and palliative care or hospice care was decided because we've really reached our max efforts with him. There's not much more that we could do supportive-wise. So they called the family. I talked to Sean after the doctors called her because I talked to her on Sunday, and just in like 2 phone calls, me and Sean bonded. Sean asked me to be here for her dad and to stand in for her family and to make sure he wasn't alone. It was an honor, and this is what we do. This is why we're here. And I made sure Sean knew, and I've told her since Sunday, before this was where we were ending up today, that the staff here call him Grandpa. Everybody's like, who has Grandpa today? Who's taking care of him today? And they don't just take care of him, they care about him. And that's true of all the patients and all the nurses here. We care for these people like they're our families. I don't think that there is a bigger responsibility than to stand at that bedside and make sure that patient knows, one, that his family loves him, that they haven't forgotten him, and that we're here in their place.
We all see that as a privilege in nursing, to be with someone at their bedside while they're going through that transition. It's almost like a midwife to the soul, and perhaps it's ironic that we're in a labor and delivery unit and we're kind of, helping that transition in someone's life.
Hey Pablo, what's up?
Hey, just checking in on you. You doing okay?
Yeah, he's starting to have periodic apnea, not lots of it, but just...
One of the challenges is not being able to have family at the bedside. Usually during a process like that, we have family at the bedside.
This is heartbreaking for all of us not to be there. They have done a Zoom meeting with us where we were all on there, all of his kids and grandkids. And so he got to see every single one of his kids and his grandkids, and everyone got to give a message to him. I've never experienced any type of care like this ever before.
Today we were able to call in before we removed the BiPAP, and she told him the most wonderful things, and she told him what a wonderful father he was, what a wonderful grandfather he was, and she thanked him for raising her to believe in God and again to have built a foundation of faith for her, and that she would see him when her time here was done.
I think there is just a unique caliber of folks that are on this department because they actually raised their hand to participate in the opening of this unit, knowing that we were taking care of this very special population being COVID positive, right at the point where we're still learning a lot about the illness and the disease. So, their spirit of wanting to do the right thing for these patients, and then just being that, good and true Houston Methodist nurse, those I care values are just oozing everywhere, and I think you've probably seen that in the teamwork today.
I'm going in to give Mr. Steubinger some more comfort meds. I'm going to sit in there with him and just be with him. Everybody else has kind of gone upstairs, so I'm going to go in and just sit with him. I've updated his daughter, and I've updated our hospice nurse. So we're just kind of waiting for him to be ready. That's what we're doing.
Tabatha has really just stood out to me because she wanted to know more about my dad, and to hear her say, you tell me what you want me to tell him and I'm going to do that. She wanted all of the names of his kids and his grandkids, and she talks to him and whispers into the ear those names to give him that comfort. All the things that we would do if we were there, she's doing for us. But Tabatha's having to be my dad's family today. It's just given all of us peace and comfort, and we love her dearly, and we can't wait until we can meet her and not be social distance of 6 feet apart, so we can wrap our arms around her and hug her and thank her, because we will never in our entire lives forget Tabatha and what she has done for my dad.
Hey Pablo.
Hey, friend. We're going to need to make a bed for Grandpa.
Okay. He's going into 5.
Okay.
We already had a plan.
Alrighty. Thanks.
Okay.
Bye. So let's just, yeah. And then we can just move him into bed. We don't need to.